The paradigms that need to be changed are that data around health and biology should not be private. It should be public. If we have to pay taxes on something, in general, we always, the governments and whoever always want to know what is it that we're purchasing? What is it that we're doing with our money? Because they want to make sure that they're getting the right amount of money. And if we want the right amount of health within healthcare, we need the right amount of data. And so hiding and keeping this data private and thinking, I don't want these people to have my data, it's the same thing that's going to kill people. And it's so important to stay alive by sharing what you can. Yeah. So the paradigm that needs to be changed there is the aspect that we need to share our data as much as we can. We need to come together. We need to stop privatizing these things. The GDPR is actually holding us back more so than putting us ahead. Yeah, there are some aspects that are there that's there to protect us. But overall, the GDPR is making the bigger companies more powerful. How do I mean that? I mean that these huge corporations had this data and they held it for a really, really long time. And then we had the GDPR come into place. So smaller companies, it's difficult for them to have data and to even compete with these larger companies that have these, backwards business models that are taking advantage of the public. And so in retrospect, we really need to look at certain areas that revolve around public safety, public health, public benefit, and make sure that anything associated with that, decoupling the identity from those metrics or whatever the case may be, the data that's connected with the user, and saying, here goes this health data. We need to share it publicly and put it somewhere where everyone can attach to it, that not just doctors can say, I know what to do with this data, but the public, we ourselves can say, this is what I'm going to do with my data, and I have a choice over my health.